Open Studio. Today's topic is lupus, and we have our guest as Dr. Moamani, who is going to be discussing the topic with us. Welcome to Open Studio.
Hi, thank you, Caroline. Just a little bit about myself. I'm head of the arthritis clinic at Tygerberg Academic Hospital, also attached to the University of Stellenbosch. And we deal mainly with people with arthritic disorders, connective tissue disorders, and lupus is one of the important diseases that we deal with.
And your background study-wise?
I am a physician. I'm also a specialist rheumatologist. And we also do a bit of teaching, looking after patients, amongst others. Yes.
Okay, thank you. Okay, many people in our communities are not quite aware about lupus. Can you please tell us exactly what is lupus and how common is lupus?
I think it's important to know about lupus because although lupus is regarded as a rare disease, it's perhaps not as common as has been previously thought. Our estimate is that it affects between 1 in 500 to about 1 in 1,000 people. So in a city like Cape Town, anything between about 10 to 15,000 of people have lupus. So
wow,
not as rare
that's quite
as we
a
think.
huge number, yes.
Yeah. We think it's probably more common in this part of the world than in Europe. And our feeling is it's probably also more severe in this part of the world compared to places like Europe.
But what kind of disease is it? Is it genetically characterized, or is it just a disorder, or how does one get it? What causes it?
Yeah, it's extremely interesting. We still don't really know what it is, but it's something that's meant to work going wrong. So, for example, if you have an infection in your body, a cold or flu, your antibodies are part of your defense mechanism to rid you of the flu. But in lupus, the system has gone the other way, where your antibodies actually attack your body's own tissues and can affect all parts of your body.
So it is a very serious illness.
Potentially serious, but let's not be too bleak. There's a lot of hope. I'll come back to how it manifests.
Great. So what are the clinical manifestations of lupus?
A very good question, because many of us are not as aware of it as we should be. Probably the most important manifestations would be a disorder of the joints, so pain and perhaps swelling of the joints, but also illnesses of the skin. Probably the most dramatic of it all is the photosensitive rash. That's a rash that looks like a very bad sunburn. Another one that is well known is the so-called butterfly rash. And in fact, the term lupus comes from the term wolf that left a mark that looks like a butterfly on the cheeks of the patient. The other one is a coin-like lesion which can occur on the face, but also other part of the body that causes pigmentation, whitish pigmentation, but also dark pigmentation. Other well-known important ones would be ulcers in the mouth, which is painless, hair loss, and very dramatically, people whose hands go cold. So typically it would go white, then blue, and then red, and sometimes all three, all in one.
Okay. So, but is this manifestations, do they happen after a patient has been, they have been detected that they do have lupus, or is it first things that happen, then a patient will have lupus?
Yeah, that's again interesting. Sometimes the signs may be a lot more subtle, and it would be symptoms that even normal people would experience. For example, severe fatigue that simply doesn't want to go away. Most of our students would say they all have lupus, but this is a particular kind of. And the other one would be constitutional symptoms like just listlessness, loss of appetite, unable to function, being able to function in the normal working environment. Sometimes, as mentioned, the disease can be a bit more severe, can affect your brain, your kidneys, your lungs, your blood system. And if you're still unsure, we often do a blood test known as the anti-nuclear factor antibody test. Okay. And that, in the context of the patient with certain symptoms, will point us to the diagnosis of lupus.
Okay. And what about patients who are immunocompromised, who have other diseases? Can they get lupus? Is there any correlation in there?
Yes, if you have what's called an autoimmune disorder where your antibodies attack your own system, you have a higher risk of developing another autoimmune disease. Wow. And in fact, one of our patients, whose name I'd like to mention, Sima Masazis, is a wonderful, one of my best patients.
By the way, she'll be joining us in another break.
She has an overlap between lupus and scleroderma and
and she managed to still survive. Wow.
And not only has she survived, but she'll tell you a story.
Wow, yeah. I can't wait to meet her.
Yes.
And again, what needs to be done? if a patient is suspected to having lupus, what are the first important things that needs to be
I
done?
think time is of the essence. If lupus is suspected, and often they present to their general practitioners or to the primary care clinic, and the patient should be referred to an academic institution or a specialist institution like Tygerberg Hospital or Groote Schuur without delay. The message is that early diagnosis leads to early treatment, and early treatment leads to a better outcome.
But my challenge is people in informal settlements. How would they get this, suspicion and going straight to academic
I think
institutions?
the answer lies in patient education. The people best placed to educate our patients are the people at the primary care level, the people working at the day hospitals, our nursing sisters, even awareness days like we're having on the 10th and 11th of May in the community newspaper to make people aware that if they have joint problems, they have skin problems, they're not functioning well, it doesn't want to go away, go and see your primary care practitioner.
Definitely, then it shows there is hope for those who don't have much to be able to get there.
Indeed.
Yeah, and
yes.
Thank you so much, and we will be taking a break and we'll be back with more. Welcome back. If you've just joined us, we are discussing lupus, and in studio with us we have Dr. Abrahams. She just joined us. Welcome.
Thank you very much.
Briefly, please introduce yourself, tell us who you are and what are you doing and your background.
Fantastic. My name is Dr. Deepthi Abraham. People lovingly call me D at work. And I work in the Department of Pediatrics in Pediatric Rheumatology. And I have been in Cape Town since 2002. And I've just stayed on because I really love being here.
Great.
Yes.
And your study background?
My study background, I was actually born and brought up in Kenya. And then I came through to South Africa when I was 12 years of age. I was actually in the Eastern Cape in a small town called Umtata. And I grew up there till I was about 21. And that's where I did most of my primary, secondary, and tertiary education. And then I came through to Cape Town in 2002 to do my internship here. And then did my post-graduation at Stellenbosch University. And that's where I got pediatrics. And then from there on, I decided to specialize in pediatric rheumatology. And that's where I am at the moment.
Okay, thank you. Okay, so she will be telling us about the prevalence and the impact of lupus in children. Firstly, does lupus affect children and how common is it? Is it gender dependent and age dependent?
Lupus affects children. About 15 to 20% of people that have lupus are actually children.
Wow.
And it is not very common before the age of 5 years. Most of the children are above 10 years of age, and you have about 60% of them falling between the 15 to 20% group. And lupus does affect children. Usually male to female ratios are the same as the child is quite young. But with increasing age, you find that more girls are affected than boys.
Wow.
Yes.
But it's quite interesting. What about during bedside? Like when a woman is pregnant about to have a child, could
Yes.
the child still have lupus by then?
We do have a concept called neonatal lupus, whereby the antibodies are actually passed on from the mum to child. But those antibodies can actually be gets rid of from the body, so the child does not have to live with the condition lupus. There are certain effects. For example, children can develop bradycardia at birth, but that too only occurs in 2% of people that have lupus, so it's extremely rare.
Okay.
Yes.
And what are the characteristics of lupus in children?
Okay, so lupus is a very complex disease. So children can present with very mild symptoms, or they can present with very severe symptoms. So the mild symptoms would include things like photosensitivity. They would have malar rashes, a fever, fatigue. They could also have arthritis. Then you have the very severe form where children actually present with increased blood or protein in the urine, or they could be very puffy because of kidney disease, and they tend to present with, severe forms of heart-related lupus, which we call myocarditis, or they can have even neurolupus where they present with psychosis, anxiety, depression, and even headaches and seizures. So it all depends on the degree of severity of the disease process.
Wow, with what you just said now, it just came to my mind to ask this. So, which means they do get lupus, but then they have different forms of lupus.
Absolutely, absolutely. Some have systemic lupus, whereby the internal organs are affected. Some only have cutaneous lupus, whereby only the skin is involved. So, again, very complex disease, difficult to diagnose, and presentation is from mild to severity.
Sure. And what about any special tests that can be done to diagnose lupus in children?
Very
especially especially in the case of a woman who's pregnant to have a child,
Yes.
or the child already been grown. Maybe you can tell us for both sides.
It's the same. We have similar tests that we do in both children and adults, so there's no difference there. We're looking at the ANA bodies, which is anti-nuclear antibodies, and we also have the anti-double-stranded DNA antibodies that we usually do. If that is high, it is usually in keeping with renal disease. So an ANA titer is what we usually do. Then there are other things that we do, like ENAs, RNPs, anti-Smith antibodies. But those are things that most patients should discuss with their doctors. And they would decide based on the symptoms that the child presents with what would be the most important one to do.
Okay.
Yeah.
I still go back again to those who don't have, means, maybe those who are staying in informal settlements, since
Yes.
this is a community show.
Yes.
What about those? Where could they be able to go and get this test being done on their children, and how do they know that their children have this disease?
Yes. So the most important thing, I think, what we need to create awareness about is the symptoms of lupus.
Okay.
Once that has been, picked up on by the parent needs to go through to the primary healthcare center. The nurse there usually makes, certain recordings of the symptoms, and it lets the secondary level doctor usually know. And at that stage would be a pediatrician. And the pediatrician is alerted, and in most secondary level hospitals, they have the capacity to do these, simple blood tests and some complex blood tests as well, which would then allow them to notify the doctors in the main centers, that's the tertiary hospital, to be able to help with management either telephonically or even have them seen at a referral, once off, with some form of advice on how to take things on. So the most important thing we're trying to do is actually create an awareness by allowing conditions like lupus to be taught in the undergraduate and postgraduate curriculum, which allows a lot of doctors on many levels, whether basic, primary, secondary or tertiary, to be able to at least diagnose lupus and be aware that lupus is present and it's not as rare as it actually seems to be.
Okay, as you've mentioned that the symptoms are the most important part, can you just label or just state few of those which are very simple to be able to see?
Yes. Now that's a nice and interesting point you brought there. Lupus is actually an invisible illness sometimes, so very difficult sometimes for children to actually say and make the parents actually understand what they're going through. And some of the symptoms include things like fatigue. How do you measure fatigue? And also when children say that they've got pain in their joints, how do we measure pain? By looking at someone. So and that's what we need to create as awareness. So when children actually say they're feeling tired, or you see a child who is usually very playful and is suddenly sleeping, lying down, performing poorly, or even at school the handwriting changes, it's because the joints are probably unwell. So very important to think of the unusual symptoms as also being important. The ones that parents can actually look for and make easy to diagnose is the malar rash that occurs on the face, which is very similar to the butterfly appearance, and that's why it's called a butterfly malar rash. And then sometimes some children do present with joints that are actually swollen, so that is visible. So when they've got things like that, then it's very important, especially if at the primary or secondary level hospital the basics have been excluded, then one needs to think, let's maybe think lupus.
So in short, how can it be treated in children, just in short?
Yes, so we have got immune suppressive treatment that we used for lupus. Lupus, the immune system tends to be quite overactive. So we're basically looking at drugs that will suppress the immune system. You've got drugs that work very quickly, the quick fixes, we call them corticosteroids, And then you've got those that are disease-modifying drugs that take a while to act, but when they do act, they act very well.
Okay, thank you.
Thank you.
Thank you. This is very interesting topic, and we will go to a break again, and we'll be back with more. Thank you. Hi, welcome back. If you've just joined us, we have our 3 guests in studio. We have Dr. Abraham, Dr. Moamani, and then we have Ms. Sima. Welcome again.
Thank you.
As you know that we're still discussing lupus, Ms. Sima will be telling us about her story ever since she was diagnosed with lupus and how she has succeeded. You may tell us.
Hi.
Or firstly, tell us who you are and go ahead.
Sure. Okay, so you said my name is Sima. My full name, what my parents call me, is Smangile Mashazi.
Okay.
And I was diagnosed with lupus 6 years ago, 2010. It was a life-changing thing. You can't go unchanged. I'd been sick for about 18 months with just random symptoms, swollen hands, fingers turning blue, joint pains. I think Dr. Mani's probably taken
Those
through
symptoms,
all those
yes,
symptoms.
yes.
And I didn't know what was actually wrong. I didn't know if I was dying slowly or,
Wow.
So when I finally did get the diagnosis, I was firstly very relieved because it has a name. So if
Which
it
is
has a
good to
name,
know
you can
something.
do something
You
about
can be able
it.
to treat it, yeah.
And so I started with the treatment, and I was very optimistic. And about 6 months in, I remember just feeling incredibly depressed, because then you realize it has a name, it has treatment, but it's not going away. And that was really difficult. And the pills are helping you, but they also have their own little side effects. And that was really hard. Things that never used to happen before. You know that this stuff is now stuff you have to deal with. The pills are helping, but this is as good as it gets. When I
Wow.
realized that was really quite harsh. But I pushed through. Right now, it's been 6 years later. I do very, very normal things. There was a time where I struggled to make the bed because the duvet was too heavy, or put up the washing because I couldn't keep my arms up too long. So those kind of things, or joint pains all the
Yes.
time, great fatigue. And I still have fatigue, and I still have pain from time to time. But I really managed to do a lot of normal things. I'm a student at Stellenbosch University,
Great.
3rd year BA, and I'm also a
Great.
musician. So I mean, I
Interesting.
use my body quite a bit. I sing.
Interesting.
And I'm part of a musical right now about the life of Miriam Makeba. There's a lot of physicality that happens
Interesting.
there. So I remember the doctor saying to me, you can never do anything more than walk. Just be gentle with everything.
Wow, and now you're
And
doing
now
all
we're
these
just
great
like
things.
Arms in the air,
Wow,
and jump
that's-
up and down, and I'm thinking, if only they could see me now,
Oh, that's great. That's a very beautiful story.
So I mean, life is good.
Great.
I'm more grateful for life as well. I feel like I have a life. If I died 6 years ago, that would have been the end. But I actually have one. It has its challenges, but I have a life, and I'm living it, and it's quite fun.
So it's more like it was a journey that kind of motivated you to.
It did.
Yeah, and when you had the disease, did you have any other disease when you had lupus, did you have any other sickness or illness with it?
Well, I was perfectly healthy until I was diagnosed with lupus, and then I found out that I have overlap. So I've got 3 little autoimmune diseases.
Wow.
Dr. Moni can explain better, but it's scleroderma and polymyositis and lupus. And the one I think probably that caused me the most pain was the polymyositis. That was why I couldn't make the bed. There was inflammation in my muscles.
Sorry to step you. So
Yeah.
these 3 illnesses, they all form a part of lupus.
They're like part of the same family.
Oh, the
You've
same,
got
but it's different
going-
autoimmune disease.
Yeah,
Okay, so
you've got like
yeah.
a brother and sister and
I
cousin.
see, yeah. I
in me,
can
that's
imagine
what you
having
got.
all these 3. So it shows that it was a very important thing to get diagnosed and know exactly what is it and how you can get treatment. And it shows also lupus can be treated.
Yes.
You just need to get it diagnosed on time. Yeah. And maybe Dr. Mohammed, can you please tell us more about these 3 other illnesses she had together?
I'm not going to go into too much detail,
Yes.
but they are family of each other. The polymyositis gives you a lot of muscle weakness. You have difficulty raising your arms above your head, walking upstairs. Scleroderma affects the skin, giving you skin thickening. And looking at Sima now, you won't recognize her from the person I met 6 years ago.
Definitely.
So it's been a wonderful outcome.
Great. Okay. Thank you for your story. Wow, it's so inspirational. And I believe all of you viewers who are watching just know that it can be treated, but you need to get it diagnosed earlier and you still have a life, like she said. And Dr. Abraham, can you please tell us also about your story? We just found out that you are a patient as much as a doctor for lupus. How has it been and how have you managed it?
I was diagnosed with lupus in 2008, but if I look at it in retrospect, I was suffering with the symptoms of lupus for about a year on before that. The most important symptoms that I had was mostly fatigue also. I was very tired most of the time. There was lots of joint pains. I lost a lot of hair as well, hair fall. And I wasn't able to do the normal things that I was able to do once, you know, kneading dough or writing fast. So those were important things to me that were a problem. And then I got diagnosed, and I think through the years, I have just learned to live with lupus and have two perspectives of it, one as a patient and one as a doctor as well. So I can say it has made me a better doctor over the years. I understand when patients come to me and tell me they've got fatigue and pain. And I think my message for the people suffering from lupus out there is that these symptoms are very real and it is not in your head. So when you do feel fatigued, it is an important...
Just to disturb all of you, I hear you've been talking about fatigue. I mean, people sometimes get fatigue. Is it different to a normal fatigue or... Because I'm getting a bit like... thinking about it.
It's constant. You know, it's constant, and I used to think if I just have a good night's sleep, and then I wake up and 3 hours later I feel like I need to crawl in bed. And I think what happens is that for me, I don't know about you, Dee, but when that happens to me, I get emotional. I get really emotional because I'm supposed to start the day, but I just have I've got no strength left for the day. And no one else knows what you're going through. I mean, if you say you're tired, then people think, I had people saying you're unfit, you should just exercise a bit more than your energy. They thought they were helping, but it was very hurtful.
Wow, it could be very tough. And Dr. Mani, can you please give an advice about what people out there they can do to deal with this?
Yes, I think it's important that if you have lupus or one of these family of conditions, it's important to be followed up by a specialist. That of course depends on what your symptoms are. But the antimalarial drug chloroquine would probably be a very important part of your treatment. There's also non-drug therapy, like make sure you don't get exposed to the sun. And if you're a smoker, and I'm happy to say my two female guests are not smokers, are important things. And if you have an infection, seek treatment earlier. But I think there's a lot of hope. So careful, a partnership between patient and doctor is essential.
Thank you for that. And if viewers would like to get information on this, do you have any links or website, or where can they get information?
Yes, there's actually an upcoming event. We are promoting lupus awareness, and some things to know about lupus. The color for support is purple. The logo.
That's why you're supporting purple.
The logo for lupus is a butterfly. And there is an upcoming event to promote, lupus occurring on World Lupus Day, which is on the 10th of May. And that is going to take place at Goedeskier Hospital. And we're having it at the Tafelberg Conference Center.
Thank you. Thank you so much for joining us, Dr. Abraham, Dr. Moamani, and Miss Sima. Thank you so much. I really enjoyed us having this conversation, and I hope all the viewers learned so much from it.
Thank you for having us.
Yeah, thank you. Great. And thank you again, viewers, for tuning into Open Studio. And if you want to be part of it, you just have to email us on openstudio@capetowntv.org or call us on 021 448 0448. And from me, Caroline, bye, God bless. And don't forget to tune in every weekdays at 5 o'clock for Open Studio. Thank you.